And well, as I was saying, I do want to thank Dr. Sharon, who made these introductions. I'm really appreciative of all that Dr. Sharon has done for the Florida Department of Health here in Orange County over many, many years. I'm truly appreciative, and you're really an inspiration. So I know that Dr. Sharon is listening. He's watching remotely. So thank you, Kevin. This is a portrait from Frank Leslie's weekly newspaper from 1873, and it's a depiction of the personification of yellow fever, yellow jack as it was called, dragging down the state of Florida, with Columbia coming to Florida's rescue. And this photo is located in the archives up in Tallahassee. And it was the yellow fever epidemic of the late 19th century that plagued northern Florida, particularly the port cities, Jacksonville, Pensacola, that really was the reason for the development of the State Board of Health. In fact, it was as his first act as governor, Governor Fleming called a special session of the Florida legislature to really deal with this yellow fever epidemic. And you can see here that that was on February 5th, 1889, and it was only a couple weeks later that the Florida State Board of Health was formed on February 20th, 1889. And this is our first health officer, Dr. Joseph Porter. He was a prominent Key West physician with great expertise in yellow fever. He had done some work in South Florida, even in the Caribbean, Central America. He was considered widely as an expert in yellow fever. He was called to Jacksonville to help deal with the epidemic, and he went and served from 1889 all the way through till 1917 when he left the post. And that was just 1 year prior to another major public health pandemic, the Spanish flu, which came in 1918. So Florida in 1890 was a much different Florida than we know now. There were less than 400,000 people in 1890. The major population centers were Key West, actually, was the greatest population center with about 18,000. Jacksonville had 17,000, Pensacola about 12,500, in Tampa about 5,000 people. Most of Florida lived within 20 miles of the Florida-Georgia border. Miami and Fort Lauderdale didn't yet exist. In fact, it wasn't until the Great Freeze of the winter of 1894 to 1895 that Julia Tuttle sent her famous letter to Henry Flagler with an envelope full of orange blossoms that demonstrated that South Florida had withstood the Great Freeze, and tried to convince him to bring his railroad down to South Florida. And that was the beginning of the development of South Florida. But mostly, except for northern Florida, Key West, Florida was a mosquito-infested swamp with sandy, very infertile soil. Most of the farming, most of the population lived between St. Augustine and Pensacola, and Tallahassee was chosen as a midpoint between the two. And the major industries were agriculture, lumber, and paper making. So Florida experienced rapid growth over the ensuing years. By 1920, there were about 1 million people in Florida. By 1960, 5 million people. And by 2020, we're just under 20 million people. Rapid growth in Florida's population can really be attributed to public health efforts in controlling disease and creating a environmental health environment, improving environmental health. This is a hard place to live in. And so really, you could make the argument that Florida wouldn't be the state that it is today, the third most populous state in the country, were it not for public health efforts. And a lot of those efforts occurred from the State Board of Health building in Jacksonville. And if you haven't seen this building, I really encourage you to take a drive up to Jacksonville. It's a beautiful old building. It's sitting vacant like an old ghost, just adjacent to the State Board, the State Laboratory in Jacksonville. So much of what made Florida today what it is occurred from inside that building. So Dr. Porter was dealing with yellow fever, dengue, malaria, cholera, typhoid. These were the issues. Hookworm, the county health departments really got their start, and Taylor County was the first county health department because of a hookworm epidemic in southeastern United States, and particularly here in Florida. So even Joseph Porter, way back then, our first health officer, recognized the importance of public health to Florida's economy and especially the tourism industry. And I think, given our experience of the last 3 years, it still holds true today. So the mission of the Florida Department of Health is to protect, promote, and improve the health of all people in Florida through integrated efforts at the state, county, and community level. We're an integrated health department. We're based in Tallahassee, but we are an accredited health department, and everything we do, we try to integrate between the state and the local counties. So what is health? Well, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health equity is the attainment of the highest level of health for all people. And public health is what we do collectively as a society to create conditions in which we can be healthy. The major responsibilities of the Florida Department of Health are to conduct surveillance of disease and health conditions, to implement interventions that prevent or limit the impact or spread of disease, and to collect and analyze vital statistics and other health data so that we can establish trends, we can inform the public, and formulate public health policy. Maintain preparedness and coordinate response for emergencies, regulate environmental activities that have a direct impact on public health, and then license and regulate health professionals for the preservation of health, safety, and welfare to the public. As I said, the administrative functions occur in Tallahassee, state level, state office in Tallahassee, and every county, all 67 counties in Florida, have a local county health department. There are 8 statutorily created divisions within the Department of Health: the Division of Disease Control and Health Protection, the Division of Community Health Promotion, Emergency Preparedness, Public Health Statistics and Performance Management, Division of Administration, Medical Quality Assurance, Division of Disability Determination, and the Division of Children's Medical Services. And it was that division that I was the Deputy Secretary of just prior to this position. This, I'm wondering if we have a pointer. Do we have a pointer? Let me use this. You can see here that this box here is the State Surgeon General, position currently occupied by Dr. Joseph Latipo. We have 4 Deputy Secretaries, the Deputy Secretary for Children's Medical Services here, Deputy Secretary of Health, Deputy Secretary of County Health Systems, and the Deputy Secretary of Operations. So Community Health Promotion, the Division of Community Health Promotion, Family Health Services. This is where our injury, safety, violence program would be, for instance, our Healthy Start program to ensure healthy infants. Tobacco-Free Florida, you've seen our ads, the Bureau of Tobacco-Free Florida. Chronic disease prevention, the Child Care Food Program in public health research. The Bureau of Epidemiology. This is a bureau that was very active over the last 3 years, tracking the COVID epidemic for us. This is a very active program. We have 70 million visitors here to Central Florida, for instance, every year. People from all around the world are descending in Central Florida, but also the potential to bring disease comes with that. We had monkeypox, mpox last fall. We had Ebola from the Congo last fall as well. The Florida Department of Health, the Bureau of Epidemiology, tracking everybody. We know when the visitors are coming, we follow, we track them for 21 days, make sure that they're healthy. Just late last night, I was notified about Marburg virus disease. The CDC was going to give a health alert notification today, as a matter of fact, about Marburg virus in Equatorial Guinea and Tanzania. We'll hear about that later today. And our division follows this, and if someone should come from one of those areas of the world and feel ill, they'll contact the Florida Department of Health here in Orange County. So we're constantly surveilling. When you go to the hospital and you have a laboratory test done or an urgent care, and one of those labs comes back positive for a reportable disease, we'll know about it within minutes. So we're constantly surveilling and protecting the public. Communicable diseases, this is sexually transmitted infections, for instance, HIV. Florida is the 2nd state in the country in terms of new HIV cases. Congenital syphilis, and syphilis is on the rise. Dramatic increase over the last 5 years in syphilis cases and congenital syphilis. Environmental health. So when you hear about blue-green algae, you hear about our bar inspections, pool inspections, wells and sewage systems. This is environmental health. and our public health laboratories, which really test for a lot of these esoteric illnesses that your commercial labs just won't do. And we have 3 public health laboratories, 1 in Jacksonville, 1 in Tampa, and 1 in Miami. Bureau of Emergency Preparedness, the Division of Emergency Preparedness. Here we have our Bureau of Preparedness and Response. This is a bureau that would be active, for instance, during hurricane, very active last fall during Ian and Nicole. Performance Public Health Statistics and Performance Management. This is the division that provides Florida with timely data and vital statistics, birth statistics, death statistics, our performance management system for continuous quality improvement, and working with each of the 67 county health departments in our strategic planning and quality improvement. For instance, our state health improvement plan, the SHIP, okay, which was just released for the next 5 years, making sure that what I've done over these first few months is make sure that our local county health improvement plan, the CHIP, is aligned with the SHIP so that we're all rowing in the same direction, establishing the same goals and really working together. We're really blessed here in Orange County with tremendous resources, major healthcare systems, a Department of Health, an active county public school system, lots of advocacy groups. What we need to do is work together to achieve some of these goals. These are the priorities in the State Health Improvement Plan. Alzheimer's disease, related dementias, chronic disease and conditions, injury, safety, violence, maternal and child health, mental well-being and substance abuse, social and economic conditions impacting health, and transmissible and emerging diseases. The Office of Medical Marijuana develops and implements the Department of Health's rules for medical marijuana. The Office of Minority Health and Health Equity facilitates planning to advance health equity. We administer the Closing the Gap program and other efforts to achieve health equity and address the social determinants of health, such as housing, food insecurity that impact on health. Division of Medical Quality Assurance. This is probably the one that most practitioners in the state deal with regularly. This is the division that issues licenses, medical licenses, nursing licenses, dental licenses. So MQA issues licenses, investigates complaints, fights against unlicensed activity, and so on. There are the MQA supports the governor's appointment of representatives to the 22 regulatory boards, including the Board of Medicine and the Board of Nursing, for instance. These are the 22 regulatory boards that exist in the Department of Health. Children's Medical Services. This is CMS provides a statewide managed care program for children and youth with special health care needs and provides essential services, preventive services, and early intervention services with kids with special health care needs. We have the newborn screening program. All 220 babies born in Florida each year have a heel stick, okay? And with that heel stick, we screen for very rare metabolic and genetic diseases, including, in addition to hearing loss and congenital heart disease. Our Early Steps program, which screens for children, infants and toddlers up to 3 years of age for developmental delay, tries to get them into early intervention services. The Child Protection Team, Poison Information Control Network, the Sexual Abuse Treatment Program, the Child Abuse Death Review, and then, of course, our research branch. And I'll talk a little bit more about each of these. Newborn Screening Program. As of 2020, we screened for 57 conditions. Most of them are blood detected through that blood heel stick that I talked about, in addition to hearing and congenital heart screening. The Early Hearing Detection and Intervention Program really seeks to identify children with hearing loss. And we have our EDDI 136 goals, screened by 1 month of age, diagnosed with hearing loss by 3 months of age, and then in early intervention services by 6 months of age. Early Steps, again, seeking to identify kids with developmental delays, who have developmental delays or who have conditions that predispose one to developmental delay, and getting them in early intervention services as quickly as possible. This is Individuals with Disabilities Education Act, Part C. Okay, and then we work closely with our colleagues in IDEA Part B, which is administered by the school district. So when they graduate at 36 months of age, they go into the school districts that then take over. Child Protection Team. This is the branch that really evaluates children who are reported to the Child Abuse Hotline. We work closely with the Department of Children and Families in this regard. In our services, our medical evaluations, we provide the medical evaluations for all kids with alleged child abuse. Medical consultations, child forensic interviews, specialized interviews, psychological evaluations, and provide expert court testimony in these unfortunate cases. I mentioned our regional poison control centers, really a model for the entire country. This is a shining light in public health here in Florida, our Poison Control Information Network. We have 3 centers, one in Jacksonville, one in Tampa, one in Miami. Depending on where your cell phone pings to, you'll be directed to one of those 3 centers. Again, the number to call is 1-800-222-1222, 1-800-222-1222. You can call that number anywhere in the country, anywhere in the United States, and your cell phone will ping to one of the nearby networks. Providing toll-free access to the public about poison information, case management of poison cases, professional consultation to emergency room physicians. When they call, as a pediatrician, I've worked and made that call to poison control. Incredibly useful, providing follow-up to the families, even to the next day, just following up with them. Prevention education to the public, and data collection and reporting. So yes, poisoning is a problem amongst kids, and we have a up and out of reach program, but poisoning is one of the leading causes of death among seniors in Florida. So accidental overdose, confusion of medications, it really goes back and forth between falls and accidental poisoning for our seniors. It's the leading cause of preventable death. Children's Medical Services Managed Care Plan is a managed care insurance plan for kids with special needs that I mentioned. And the Florida Child Abuse Death Review. This is a really important program to really try to analyze all child deaths and have a greater understanding about how it happened. These are child abuse or neglect deaths, and to develop data-driven recommendations for reducing future such deaths. And I'll talk a bit more about drowning, safe sleep, infant sleep-related death, and inflicted trauma deaths among kids. The county health systems, again, oversees the 67 county health departments in the state of Florida. It's really, these county health departments serve as the liaisons between Tallahassee and the local government and communities. DOH operates county health departments in 67 counties. And for this reason, we have nearly 13,000 full-time equivalent employees here in the Department of Health. 13,000 with 6,000 OPS or part-time employees. It's a massive organization. We've got a $3.3 billion budget each year, and it's because we're in every single county in the state. Now, at the local level, here at Florida Department of Health here in Orange County, we have these programs, vital statistics and health records. If you need a birth certificate, a death certificate, we have that information, and you can get that from us at our office. Emergency operations. We were heavily involved in operating the special needs shelters in the fall during Ian and Nicole. These are special shelters, not general shelters, but special shelters for people with special healthcare needs. If you require oxygen, if you require a ventilator, or if you're memory impaired, you would come to a special needs shelter. And I've never experienced one of these before last fall, and it's just a beautiful service to see the kind of people that were there, usually elderly, alone, nobody else to care for them. This is truly a great service that the Department of Health offers in staffing these special needs shelters in conjunction with local Orange County government. The Office of Performance and Quality Improvement. This is where we really monitor what we do. Is it effective? Are we making a difference? Using that data, rapid implementation of programs, studying the effects, and then revisiting, and rapid cycle of improvement is what we do. Environmental health, we talked a little bit about that. Lead inspection, water quality, inspection of bars, for instance, sewage treatment. You hear about blue-green algae all the time. These are some key environmental health programs. Infectious disease. I mentioned our epidemiology program, constant surveillance for disease outbreaks, sexually transmitted diseases. We really talked about the rise of syphilis, for instance, over the last 5 years. And with that has come a rise in congenital syphilis. Most babies born with congenital syphilis die as stillborns, and those that do survive are severely developmentally disabled for the rest of their lives. And so the cost of treating a case of syphilis is about $6. It's a penicillin shot versus the alternative. So every time there is one case of congenital syphilis, it's really thought of as a breakdown in the public health system. And we're reinstituting our congenital syphilis review boards to figure out, to really study these cases individually and figure out how these happened. We have our Sunshine Care Clinic for HIV and AIDS. Again, I mentioned we're the second leading state in terms of new HIV cases. We administer the Ryan White program for patients with HIV. Our Area 7 is really, we serve, Orange County serves as a hub for the regional counties, and this is Area 7, we call it, for all of our HIV services. So we're promoting, active testing, early PrEP, pre-exposure prophylaxis, testing, home testing, early treatment, and really bringing that viral load down to undetectable, because then it's untransmissible. So we've come a long way in the last 35, 40 years in HIV, but we still have a long way to go here in Florida. We have an active tuberculosis program, directly observed therapy, where we watch patients take their tuberculosis medication to keep it latent. Refugee health. We have a really large refugee health program. We've seen a real increase in refugees coming to Florida and this part of the state in particular. We have a backlog that's arisen over the last 3 years due to the pandemic. We're really focusing on bringing down that backlog, people coming from Cuba, from Haiti, from the Ukraine, from all over really. And so our active refugee health program, we provide the medical screening, the medical exams that they then need to go on and get things like work permits and driver's licenses and so on. Our maternal child health program, the Women, Infant, Children program, classic public health program, coming up on 50 years in existence here in the United States, the supplemental nutrition program for women, infants, and children, providing food and nutrition, supplemental nutrition to women who are pregnant and their infants, toddlers, and children. Probably no greater return on investment than adequate early nutrition for kids and adequate nutrition for pregnant mothers. This results in healthy pregnancies and healthy children. So return on investment is great. It's a wonderful program. The Healthy Start program, ensuring that our children get off to a healthy start. We are now kicking off our Fetal Infant Mortality Review Committee, of which I'm the chair for Orange County, where we look at fetal and infant deaths and figure out, how did this happen and what can we do to prevent these unfortunate deaths. We had our first meeting 3 days ago, and we found that of the 3 cases that we reviewed, 2 of them had no prenatal care. 2 women had no prenatal care. So how do we get women into adequate prenatal care quickly? How do we reduce the barriers that may exist due to misperceptions, distrust of the medical system, language barriers, and so on? What are these systems changes that we can make to really improve fetal and infant mortality? And the disparities that exist between Black, non-Hispanic infants and white Hispanics is unacceptable, and really reducing that disparity between Black and white infants in terms of infant mortality. Florida Asthma Program, the Family Planning Prenatal Health for underinsured or no insured women, our Breast Cancer and Cervical Cancer Early Detection Program, Florida Healthiest Weight, and the School Health Program. So strong ties to Orange County Public Schools, really ensuring that our kids are immunized when they start and protected when they come into kindergarten, and are protected from other children when they come in around other children, and then have their boosters, the 7th grade booster shots. We have particularly low rates of immunization completion forms here in Orange County for kindergartners and 7th graders, and I'm working actively on that with leadership at Orange County Public Schools to fix that. Our SWAT team, our Students Working Against Tobacco, that we're starting. So really student-led, peer faculty mentored programs within schools to prevent children from starting to smoke or to vape, and to help adults who wish to quit smoking. And we have our dental program, a dental sealant program for schools. We send buses out, provide dental sealants, probably nothing as important as good oral health, okay, and making sure that kids have these dental sealants to prevent cavities. And of course, our free immunization program for children who need immunizations. So this is a broad overview of the Department of Health, but the Child Abuse Death Review. This is a unit that I used to oversee in Tallahassee. it really is important to me, really looking at these preventable cases of child abuse and neglect and figuring out what we can do to prevent them from happening again. And of the cases that are reviewed by the Child Abuse Death Review, the most common cause of death is sudden unexpected infant death, oftentimes sleep-related due to unsafe sleep practices. In fact, let's not even look at the cases reviewed through the CADR. Sudden unexplained infant death is the leading cause of preventable death among children in Florida. Okay, so we really do need to get that message out to caregivers when they have infants under 1 year of age, not to co-sleep, always on your back, no pillows, blankets in the crib or bassinet. Most of these deaths happen in the first 4 months of life. So to that end, we're working with our healthcare partners, Advent Health, Orlando Health, Nemours, and HCA Lake Nona, to make sure that all of the maternity hospitals here in Orange County are Safe Sleep certified through the Cribs for Kids program. This is a recognized program out of Pittsburgh that uses National Institute of Child Health Quality data to really standardize the information that parents and caregivers get when they're moving through the maternity hospitals. And then what we're working on is a follow-up program so that we can reinforce the message once the people get home, not to co-sleep, not to place babies in bed with other siblings or with parents, and message that continually. Drowning is the second leading cause of death among children reviewed by the CADR. Completely preventable. Florida leads the nation in terms of child drowning fatalities amongst 1 to 4 year olds. And children 4 years of age make up 86% of the 2021 drowning related fatalities reviewed by the CADR. Ineffective barriers of protection and failure to provide adequate adult supervision continue to be the primary contributing factors. You can see here that again, drowning is the leading cause of death among children 1 to 4 years of age. This is data from 2016 to 2020. You can't see it, it's 279 cases here in Florida between those years, 1 to 4 year olds. This is from our Child Abuse Death Review last week. We reviewed this case from 2022. And I hope you can all see this, but you'll see retention ponds like this everywhere in Florida, okay? Retention ponds in homeowners associations that have zero barriers around them. This is someone's backyard. Little toddler just walked right in, and the X indicates where he was found, drowned to death. And we see this every time we meet for the Child Abuse Death Review. We see cases just like this. It's not just pools, but retention ponds. Something has to be done about this. And if the homeowners associations don't want a big metal fence for aesthetic reasons, we can put low shrubbery. Low shrubbery would be just enough to keep a toddler from going in. If it were thorny, low, that would be enough. It's aesthetically pleasing. There's nothing, more than that. It's quite simple, actually, to prevent just this. That's the memorial for the child victim that was placed. You can see here the top counties for drowning between 2016 and 2018. Florida is in the top 8. We were successful when I was in Tallahassee. We were successful in getting approved by the Florida legislature and the governor $2.8 million in recurring general revenue to really address sudden unexpected infant deaths and drowning here in the state. We're going to focus and use some of those funds on the top 8 counties in the state: Hillsborough, Broward, Miami-Dade, Duval, Palm Beach, Orange, and Polk. So we'll be receiving some of those funds, and you'll see a lot of activity here in Orange County. You can see here that our drowning death rate for children is about 1.9 per 100,000, with a slight uptick there during the COVID pandemic, and that continued in 2021. There's a seasonality to it. While we're surrounded by water and we have nice weather all year, and drownings happen all year round, there is a seasonality here in Florida. You can see that most drownings happen in April, May, June, and July when kids are out of school. This slide depicts that males are twice as likely as females to drown children. You can see here that the 1 to 4 year olds, 1 to 4 year olds are the target age group that we're really concerned about, and we need to target our efforts towards those. 70% of child fatalities between 2016 and 2020 in Orange County were in the 1 to 4 age group, followed by 14% in the 5 to 9 age group. So you can see here the infants, as they get older, the cause of death from drowning changes. Under 1 year of age, it's in the home, bathtubs, toilets. From 1 to 4, and then from 5 to 9, it's swimming pools. And then as we get older towards the adults and adolescents, it's natural bodies of water. And we can target our messaging towards that based on the data. 70% of children 1 to 4 weren't supervised. And you can see the point of this slide is only 3.5% of children drown during swim time activity. So it's really non-swim time activity that we need to focus on, okay? Adequate barriers of protection and adequate supervision. You can see here that 80% of fatalities in children occurred among Florida residents, 20% among non-Florida residents. So a lot of our efforts are geared towards Florida residents, yes, but also tourists. You'll see us in the airport, you'll see us at Airbnb. We're really using this data to drive our initiatives, okay? And so that's all. I think what I hope that you gain from this is a better appreciation of a massive department, the Florida Department of Health, what we do integrated at the state, county, and community level. As I said, we're blessed. We have lots of resources here. My job is to really orchestrate and coordinate all these efforts, make sure we're all trying to achieve the same goals and grow in the same direction. And I'm thrilled to be here. So thank you for inviting me.